Hello everyone, welcome to my first ever YouTube video. Today I'll be explaining the physiology of gastric acid. So to make it easier for you guys, I'm gonna split this topic into 3 subtopics, which includes the types of glands in the stomach, the constituents of gastric juice, and the physiology of gastric acid secretion. Please enjoy. So within stomach mucosa, there are 2 different types of glands, the oxyntic and the pyloric glands. So the difference between these 2 glands are actually the cells within them. In this diagram, you can tell that in the oxyntic glands, there are surface mucosal cells, parietal cells, ECL cells, D cells, and chief cells. In the pyloric gland, however, there are also surface mucosal cells and D cells, but they also have G cells and mucous neck cells. So all these different cells have different functions, which contributes to the role of the whole gland. For example, the parietal cells in the oxyntic glands are responsible for the secretion of hydrochloric acid, HCl, whereas ECL cells secretes the hormone histamine, D cells secrete the hormone somatostatin, and the chief cells secrete pepsinogen. So I'll explain later on the functions of these secretions. And in the pyloric gland, it has D cells that also secrete somatostatin, but it also has G cells that secrete hormone gastrin, which I will also explain later on. It's also quite important to know where these glands are located in the stomach. So for example, the oxyntic glands are located in the body and the fundus, which is around 80% of the whole organ. The pyloric gland, however, is located in the antral portion of the stomach, just before the duodenum, and it's around 20% of the whole organ. So from understanding the types of cells in the glands of the stomach, you can kind of know the different constituents of gastric acid. The most important one is obviously hydrochloric acid, which denatures food, unfolds protein, and makes the environment really acidic, making the pH really low. So this acidic environment is really important because it helps activate pepsinogen, and it's the optimal condition for the enzyme pepsin to function in. HCl is secreted by parietal cells that we mentioned before in the oxyntic glands. We also have pepsinogen in the stomach, which gets activated by hydrochloric acid into pepsin. Pepsin is responsible as an enzyme to digest protein. In fact, it digests around 20% of the protein consumed. Pepsin is also secreted by chief cells in the oxyntic glands, so the same glands that secrete HCl. We also have intrinsic factors as part of the constituents of gastric juice, and intrinsic factor is responsible for vitamin B12 reabsorption. A lack of these intrinsic factors can lead to a condition called pernicious anemia, but that's another topic. These intrinsic factors are also secreted by parietal cells in oxyntic glands, which kind of shows how important these oxyntic glands really are. Another constituent of gastric acid is bicarbonate. So bicarbonate is really important because of its physiological pH buffering role, and they're secreted by epithelial cells and are usually underneath the mucus. They're responsible to quickly neutralize the acid, so in case when acid does leak out past the mucus as the physical barrier, it can neutralize it. Last but not least, we have mucus, which are hydrated mucin and acts as physical barrier against gastric contents. This physical barrier is quite important because it prevents the gastric juice to digest the own cells of the stomach. As we have already mentioned, hydrochloric acid is secreted by parietal cells in the oxyntic glands. But how does this actually happen? In this diagram, there is the canaliculi lumen, which is where the hydrochloric acid is secreted to, the parietal cell in the middle, and the interstitial space / extracellular fluid. For the hydrochloric acid to be secreted, the main driving force in this reaction is a proton pump, more specifically hydrogen potassium ATPase, which is located here right between parietal cell and the lumen. The first step is actually the dissociation of water into hydrogen ions and hydroxide ions within the parietal cells. the hydrogen ions are actively pumped out to the lumen via the hydrogen potassium ATPase, whilst potassium are pumped in from the lumen into the cell. Potassium are actively transported into the cell via a basolateral sodium potassium ATPase, and then the potassium tends to actually leak out on its own from the parietal cell into the lumen, but is usually reabsorbed back via the potassium hydrogen ATPase. So the hydroxide ions within the cells binds to carbon dioxide, which forms bicarbonate ions. This reaction is usually catalyzed by carbonic anhydrase enzyme. Bicarbonate ions is then exchanged with chloride ions from the interstitial space basolaterally. The chloride ions is then secreted via chloride channels to the canaliculi lumen from the parietal cell. This means the hydrogen ions that are actively pumped from the parietal cells into the lumen can bind to the chloride ions that is secreted via chloride channels from the parietal cells into the lumen, forming hydrochloric acid. It is important to note that water also passes into the canaliculi lumen from cells via osmosis. So the end product is generally a majority of hydrochloric acid in the lumen, a little bit of potassium chloride ions because potassium can actually leak out from the cell into the lumen as well as a very little amount of sodium chloride. Thank you guys so much for watching. If you liked the video, please leave a like and subscribe. If you have any questions, please leave it in the comment section below. That's all, and have a good day.